Hello class, my name is Hunter Stroop, and today I am going to be presenting my presentation on benign neoplasms. You may not recognize the word neoplasms right off the bat, but neoplasms are more commonly known as tumors. A tumor is an abnormal growth of tissue commonly caused by cells growing and dividing at an abnormal rate. What causes a benign tumor to form? A tumor is caused by the body producing extra cells, and the buildup of these unregulated cells are what forms tumors. Often, the cause of a tumor developing is hard to discern, but several factors such as your genetics, if you have been exposed to radiation or toxins that are similar to radiation, your diet, and etc. can be linked to the development of a tumor. Benign versus malignant. The definition of the word benign medically refers to a more gentle kind of infection, while malignant recurs to a very severe and infectious case. Benign neoplasms are abnormal growths of tissue, as are malignant neoplasms, but unlike malignant neoplasms, they are not invasive, nor are they fast-growing. Although it is true that there are certain types of benign tumors that can become malignant. Malignant neoplasms are more commonly associated with cancer, which is very invasive and can be much faster in spreading throughout the body. Characteristics of benign neoplasms. Characteristics of benign neoplasms includes a very slow growth rate, much slower than a malignant tumor. There is also a resemblance to the tissue that it originates from. So the cells that make up the surrounding area of the tumor will be very similar to the cells that are actually in the tumor. There is a lack of invasion with benign neoplasms. They're not as likely to spread throughout your body. There is also an absence of metastasis. Metastasis is a characteristic of cancer or malignant tumors where more tumors grow away from the original site. Other characteristics of benign neoplasms are that they tend to remain localized and don't really grow out of the area that they are first noticed in. They are, once again, not as likely to spread throughout your body. Most patients survive having a benign tumor, but some tumor locations can cause serious problems. These locations include your brainstem, your spinal cord, your pituitary, etc. These locations can cause medical problems without being cancerous, just by being in tight areas. If the tumor grows and the mass is large, it can block critical body functions from happening. If left untreated, some benign tumors can grow large and lead to serious complications. And benign tumors can also mimic malignant tumors. And so for this reason, they are sometimes treated as you would treat a malignant tumor or cancer. Treatment for benign neoplasms. Since benign neoplasms are not cancerous nor invasive, treatment for them usually consists of just a doctor keeping a watchful eye on the neoplasm or the tumor and the area it is in, making sure it isn't growing too large or becoming malignant. Sometimes surgery is required, and also sometimes cancer-killing methods such as radiation and chemotherapy are applied to benign tumors as well as malignant tumors. This is my works cited page, and thank you all.